Muscles controlling the frown include corrugator and orbicularis, which move the brow medially, and procerus and depressor supercilii, which pull the brow inferiorly. We use 7 injection sites when treating glabellar frown lines and vary the dosage according to the individual brow.
So we start off with an injection into the procerus, which is going to be at the intersection between the medial canthus and medial brow on each side.
In an average female brow without a great deal of muscle mass, we use a total of 25 units of Botox.
See it there? You feel it there a little bit? We're just gently putting it in. It's like anything. If you put it in slowly, it's a lot less stingy than if you put it in at a real hurry. And then we just gently massage the bleb across the bridge of the nose, slightly increasing the diffusion circle so that we get into some of the depressor supercilii muscle. Now we're going to inject the medial head of the corrugator, and we lift it up. We can see it here. Our landmark is the medial canthus, and so we're lifting up. Be sure you use the medial canthus as the landmark, because otherwise you might be fooled, because people shape their brows, and brows can start more laterally. The apparent brow can. So I'm just going to put 6 units into the head of the corrugator, again very slowly. And then I'm angling this up, because remember, her frown lines are very tall. So we're going to go up like that. So now we've treated the entire medial head of the corrugator. And we'll do the same on the other side. Just frown again for us. So you can really see that this is big muscle here, and she recruits all the way out to here. So we have more work to do. Just relax for the injections, though. It's much more comfortable for the patients to relax during the injections than it is to inject into a tight contracting muscle. Again, we've got our landmark from the inner canthus, and we're going right into the head of the corrugator right here. And 6 units into the head of the corrugator, and then 4 units up high, and that's going to give us a beautiful smooth brow. If we get a little bead of blood like we did there, it's very common. I usually put a tiny bit of pressure upwards, but I don't let the patients manipulate their brow themselves here, because I don't want to push the botulinum toxin down into the levator muscle of the upper eyelids. So we just, usually it stops very, very quickly. Now we're going to do a little more injecting of the brow in order to soften the action of the corrugator. Frown again for us, please. We can see these lines here. These are very important lines because they tell us that there's active muscle here. If we only use these 3 injection sites, we would have Collie coming back saying, well, I like it here, but I can still frown over here. Now this is where it's very important that when we treat the rhytids here, that we palpate the notch. We all have a notch here, sometimes it's very shallow, the supraorbital notch. And we want to inject approximately 1 centimeter above that notch, simply because of the Botox diffusion circle. If you inject, as it's so tempting to do, into the brow, then the diffusion circle includes the levator of the eyelid. If we inject above the brow, the diffusion circle includes a little orbicularis and frontalis, but you also get the lateral portion of the corrugator. So we'll do this also on Collie's left side. Again, I'm palpating the notch, and I'm injecting approximately 1 centimeter above, and I'm just injecting through the skin. I'm not going down to periosteum and bouncing back, as has been advocated by some authors, because I think you can tell you're in the muscle just by going through the skin, and it's much more comfortable for the patient.